So I'm Dr. Ariel Garfinkel, owner of the Smile Garden of East Windsor in Windsor, Colorado. And fixed implant supported dentures are a great option for people because they allow people to have their dentures screwed into implants and they can never take them out unless they come into the dentist. So they act very similarly to their natural teeth. The difference between fixed implant supported dentures and removable implant supported dentures is with the fixed option, the patient cannot take out the denture themselves. They have to come into the dental office to remove the denture to get the implants cleaned. The removable option is something that they can snap in and out. It requires also less implants than the fixed option. But patients can remove the denture themselves and can clean around the implants themselves at night and in the morning. Lots of patients prefer the fixed implant supported denture option because they want something that's as close and as similar to their natural teeth. They don't want to be taking their teeth in and out at night. And they don't want something that's going to rock or move. And so the fixed option gives people the best opportunity to have dentures that are most similar to their natural teeth and have the most chewing strength compared to their natural teeth. Having a fixed permanent smile can completely change someone's life. It brings you right back to that experience of having natural teeth that you don't have to think about, that you can just brush and take care of like your natural teeth. And you can chew all the foods that you want to chew, and you can smile confidently knowing that your teeth aren't going to be moving, that they're not going to shift, and that you have something that is going to last. So the recovery process after getting a fixed implant denture can look a little bit different for everybody, but usually people are pretty sore for the first week or two. Really, you want to be eating soft foods with your new denture for a good few months to help those implants heal and get used to having that new denture. It really is a learning process for people to have all of a sudden this new appliance in their mouth. And so talking can be a learning process, chewing is a learning process. And so people really need to give themselves grace and time to relearn these skills with a new appliance. Technology has really been such a help when planning for these kinds of treatments with implants and dentures. We have a 3D imaging system in our office, the CBCT, that shows us exactly where the bone is in people's mouths. And so we know exactly where those implants ideally should be placed and if someone is a good candidate for it or not. We're getting great feedback from people once they adjust to their new implant supported denture because they feel so confident smiling and they feel so much more comfortable chewing. They feel like they're able to just live their lives without having to think about their teeth like they were before. And so people are just having such a great time with these implant supported dentures because all of a sudden they don't have to think about their teeth anymore. They're just there, a part of them, and they feel like natural teeth again. So the best way to get started with implant supported dentures is to contact our office and schedule an appointment. We will take a 3D scan to look at your bone and see if the quality is good for implant supported dentures or if we need to talk about additional surgeries to create the space that we need for the implants.